Hi, my name is Sydney Nutma, and I will be talking about ineffective communication techniques with regards to dealing with a patient who's suffering with borderline personality disorder. So, ineffective communication techniques can greatly impact the success of the patient-nurse relationship, consequently affecting the patient's ability to improve with their condition. Since patients suffering with borderline personality disorder often have difficulty with maintaining consistency in relationships, as well as struggling with emotional instability, it is important that caregivers especially avoid language that could exacerbate the patient's symptoms. So, some of the ineffective communication techniques that some nurses sometimes feel inclined to use include excessive questioning or asking why questions. For example, why were you so happy 5 minutes ago and now you're upset? Or why did your mood completely change? Using that technique of asking too many questions or asking why too many times can cause the patient to feel criticized and confused, often leading to defensive behavior. Individuals suffering with borderline personality disorder can have drastic mood changes, so asking questions that put them on the defense can only exacerbate those feelings of potential hostility. So for somebody with borderline personality disorder, asking too many questions can increase their irritability and cause them to become hostile towards the nurse. And then another ineffective communication technique would be approving or disapproving. So for example, I'm proud of the way you thought before you acted, or you need to be less impulsive and think before you act. Using those techniques can cause the patient to feel falsely validated or falsely devalued and activate their splitting defense. So basically, the splitting defense is either seeing a person as extremely good or as extremely bad. So they might look at the nurse, if they're validating them, falsely validating them. They're a really good person. Obviously, they're going to appreciate being praised and stuff like that. Whereas if the nurse turns around and then is disapproving of some kind of behavior, they might then see the nurse as a really bad person or completely like just their enemy. So then their countenance towards the nurse could shift completely, and they might be completely uncooperative with care and so forth. It just exacerbates their symptoms. And then another ineffective technique is giving advice, such as, you should go to a support group, it will help. This technique can increase a patient's dependence on the nurse, blurring the boundaries of the professional relationship while creating more of a social relationship. Generally, you'd give advice to a friend. You shouldn't be giving your own personal advice to a patient. If the nurse fails to give the right advice, the patient may blame them for the consequences of the advice that they followed, again creating potential splitting defense, looking at the nurse as either a really great person or a really bad person. And then another ineffective communication technique is minimizing feelings or making promises. Basically making promises that you can't keep or that you can't ensure will come to pass. So, such as, everything will be fine. This technique can cause the patient to feel invalidated if you're minimizing their feelings of they might be really stressed or be having some kind of mood instability or just, emotional distress. And if you're like, everything will be fine, then they're going to feel invalidated. And then it can also lead to a patient feeling betrayed or lied to if you're saying something like, everything will be fine, when in fact it doesn't actually end up being fine. The patient may lose confidence in the nurse's ability to provide care if trust is broken, and then also that could activate their defense mechanism of seeing that person as either, like, if trust is broken, well, you can't trust that nurse, they must be a bad person. That could potentially be something that somebody with BPD is thinking. But anyways, those are just some of the ineffective communication techniques that nurses should avoid when dealing with patients with BPD.